One of the biggest misconceptions I hear from patients is, this minimally invasive bunion surgery sounds new. Is it experimental? And truthfully, I completely understand why people ask that. When patients hear that bunion surgery can now be done through tiny incisions with immediate walking afterwards, many assume it must be some brand new procedure. But minimally invasive bunion and hammertoe surgery is not new. In fact, many of these techniques have existed for decades. I'm Dr. Lance Reeves, triple board certified foot and ankle surgeon, and today I want to explain why minimally invasive surgery is not experimental, why many patients have never heard about it, why most surgeons still train traditionally, and what completely changed my perspective on foot surgery. I understand the confusion. When patients hear things like tiny incisions, walking immediately, no permanent hardware, local anesthesia, it sounds dramatically different than what most people think bunion surgery looks like. Most patients grew up hearing stories about large incisions, crutches, months of recovery, painful hardware, or being off their feet for long periods of time. So naturally, when they hear there may be another option, the first thought is, wait, is this experimental? But here's what many people don't realize. Minimally invasive bunion and hammertoe surgery has actually been around since the 1980s. Many of the surgeons I trained under and later learned from have spent decades refining this perspective and improving outcomes. In fact, here's a textbook written in 1983 outlining many of the same minimally invasive concepts and procedures I still use today. So this is not some brand new social media trend. These techniques are built on decades of surgical evolution and experience. So the next question becomes, if minimally invasive surgery has been around this long, why aren't more people doing it? And the answer is actually pretty simple. Most surgeons are still trained primarily in traditional open surgery techniques. That was my training too. I trained very traditionally in an open surgery environment. That meant larger incisions, plates and screws, significant soft tissue dissection, and patients often not walking at all for 6 to 8 weeks after surgery. And for my residency program, minimally invasive surgery simply wasn't heavily emphasized or taught. So a lot of surgeons finished training without meaningful exposure to this type of technique. And honestly, that was me too. After seeing patients go through difficult post-operative recoveries from traditional surgery, I started asking myself an important question. Is there a way to achieve good correction with less surgical trauma? Because as surgeons, we always want to improve outcomes while minimizing unnecessary disruption to the patient. That curiosity is what eventually led me to an organization focused specifically on minimally invasive surgery. My mind was blown. I had the exact same questions many patients have now. Why isn't everyone doing this? Why isn't this more mainstream? Why had I not seen more of this during my residency training? And what I realized is that many people simply don't know these options exist. Seeing difficult recoveries is what pushed me to search for something less traumatic for patients. One of the biggest differences with minimally invasive surgery is the philosophy behind it. The goal is to achieve correction while minimizing the overall surgical footprint on the body. This can include smaller incisions, less soft tissue disruption, less swelling, less post-operative pain, immediate protective walking, and avoiding permanent hardware. Now, this does not mean every patient is a candidate for every minimally invasive procedure, and it doesn't mean surgery becomes effortless. Surgery is still surgery, but for the right patient, minimally invasive techniques can be an incredibly powerful option. The goal is going to be the least amount of surgical footprint possible. One thing I always want patients to understand is this. Minimally invasive surgery is still surgery. It still requires training, precision, careful patient selection, and proper post-operative care. But when performed appropriately, these procedures can produce excellent outcomes for bunions and hammertoes. And that's why education matters so much, because many patients don't realize these options exist. And a lot of people spend years living around foot pain because they assume surgery automatically means a major recovery. And for some people, that fear alone prevents them from even exploring their options. My goal is to never pressure patients into surgery. My goal is to educate patients so they understand what modern treatment options may be available to them. Because the more informed patients are, the more empowered they become to make decisions about their health and quality of life. If you found this video helpful, make sure to subscribe, follow along on social media, or drop your questions below. I'd love to continue making educational videos on these topics, specifically around your questions.